Well, hi everyone, this is Dr. Geo with this week's video introduction to week number 4 of our course in the Theoretical Foundations of Education. And once again, a very good week of discussion. Your primary task in the discussion this week was to identify a course that you might find interesting to teach or that you would like to teach, and then to identify five objectives going along with that course, and then to describe a little bit about the assessment techniques and some of the important concepts of assessment. And that was really, I think, most of the focus this week in the discussion was really talking about that assessment piece. How would you assess, and what are some key things in the assessment, and what are some key strategies that you want to keep in mind as you are teaching the course? One concept that came up this week I want to discuss a little bit is this concept of formative versus summative evaluation or assessment. And this is an important concept. Whenever we're doing a class or giving a class, it's important for the instructor to understand what are the feedback tools, or what are the assessment tools that are going to be used as a student is beginning to formulate or develop their critical thinking, or formulate their ideas about a particular idea or project, or whatever concepts are related to the objectives for that particular course. A formative assessment is meant more as a assessment that gives a student feedback, and it serves two purposes. One is to evaluate and serve as a form of assessment for grading, but also as a way of giving feedback to tell the student, you know, you're getting some concepts really well. You're getting the idea here. Here's how to take the concepts even further, or here's how to even expand a little bit more what you've done already. In the clinical setting, for example, we might use this as you may have students doing some form of an ISBAR assignment, for example, or possibly doing a focused assessment on a patient with the idea that you're going to give them feedback and let them know how they do it on that assessment. And that's going to help prepare them for their final task for the course, which may be a concept map or a care plan, where they have to take all of those little formative pieces that they've been getting and put them into one large summative whole. And then the summative assessment is sort of that final assessment. The summative assessment is the one that most closely aligns with the course objectives. A formative assessment usually will identify on just one or just a portion of the objectives for the course, where your summative assessment focuses on the objectives more overall. So that's just wanted to cover that because you're going to hear those terms a lot in education. It's important to understand what those terms mean. Also, flipped classroom came up. I didn't really notice it until a little bit later, and I was giving a lot of feedback on the papers since Friday, so I didn't really get to jump in and give my idea and my thoughts on flipped classrooms. We'll talk about it a little bit more as the class goes on, no doubt, because flipped classroom is a term that you hear a lot. It's kind of a new buzzword in education, and everywhere you go at nursing conferences and nursing education conferences, you hear a lot about this term, about a flipped classroom. For those of you that may not have heard that term or don't really fully understand the term, the idea is that well, so I'll start with the traditional classroom. And in the traditional classroom, students, before they come to class, they read chapters. They maybe have to do a couple of assignments, and then they come to class and then hear the teacher lecture. And usually in the classroom, it's a traditional lecture. And then they go home, and then they, again, do more reading and come back and get more lecture. This is a very passive form of education. The teacher isn't really actively engaging with the students. All the teacher's doing is just, in many cases, just reiterating what's already been talked about in the reading. So, or maybe explaining some points about what's in the reading. But it's a very passive form of education, and it doesn't keep the students very actively involved. In a flipped classroom, what happens is the student goes home and they watch the teacher give a lecture, or they watch the teacher do some activity, usually in a video of some sort, and then do their reading and get all their learning up front. And so when they come to the classroom, then they're going to be actively engaged in something, something usually hands-on, very experiential in focus. And so that's really what the flipped paradigm is all about. A lot of research on flipped classrooms, and the general consensus is that flipped classrooms help to keep the students more engaged, that the learning is more active, and that the achievement towards outcomes is better. However, it really all still depends on the teacher. The teacher, whether it's a flipped classroom or not, if it's a traditional classroom, it all really kind of comes back to how good is that teacher at teaching. The teacher still has to be engaged in either case. So just because a classroom is flipped doesn't necessarily mean that the education is going to be better, and it's not going to make a teacher that's not actively engaged. If a teacher isn't actively engaged in a traditional setting, they're likely not going to be in a flip setting as well. And it's actually a lot more work, at least a lot more work up front for the instructor to convert their classroom to a flipped environment. So again, we'll get a chance to talk about it a little bit more throughout the class, but it did come up in the class and I didn't want to cover it and discuss it here. Also, assessment methods came up and discussion of assessment methods. I made the comment that multiple choice questions tend to be poor measures or poor ways to evaluate critical thinking. And a couple of you had come back with some citations and examples about where it discusses in the literature about how you can assess critical thinking. And I would agree with that. I think that I may be sold a little bit too hard the idea that you can't measure critical thinking through a multiple choice test. You can, in fact. However, it is not really the best way for a student to learn critical thinking through multiple choice test. You can assess through through multiple choice tests. You can assess critical thinking and you can assess clinical judgment skills. However, case studies and reflective journals and other written forms of assignment really make much better formative assessments for the students so they can get feedback, and they are much better learning activities for learning critical thinking. And of course, the NCLEX examination is an example of a very well designed, very well done critical thinking test. That's really all that the NCLEX is one big, huge critical thinking test relating to nursing practice. So I would agree and would correct myself that yes, you can assess critical thinking through multiple choice tests, but it's not the best assessment technique when you're trying to give formative assessment to a student trying to learn critical thinking. If all that a class is doing is using multiple choice test, that in and of itself alone is not the best assessment technique to use. So again, an overall a very good week of discussion. I also have graded all the papers. It takes quite a bit of time to grade those. You'll see the feedback. I've left you feedback on a rubric as well as individualized feedback in the preview window in Blackboard. If you go to your paper and scroll to the right, you'll be able to see my comments. Mostly, I think most of you will probably come away that I give a lot of feedback on APA and writing, which is important because APA and writing actually go hand in hand with content. In order to explain your content, you have to have really clear writing. So there is quite a bit of APA and stylistic feedback, individualized for each one of you. And if you have any questions, please let me know. But the only way to get feedback, and please remember this, the only way to get to improve in anything that you do in education is to get feedback on it. So my idea with giving you feedback is not to try to make you feel like, oh my gosh, I'm trying to be hypercritical here or anything like that. I'm just trying to give feedback. The only way that you can get better on something is to get feedback on it. And learning how to write well is a really important skill, especially if you're going to be a nursing educator, because you too will be grading papers some days. So with that, we are going to move on to week 4, and we're going to talk a little bit. In week 4, the focus is going to shift a little bit to, again, the evaluation process and how we evaluate and how do we come up with assessments and how do we generate activities in class that help to build critical thinking and help to build knowledge. So that's going to be our task for today. I look forward to participating in class with you once again this week. The discussions have been very good. They've been I've been very impressed with everybody's ideas and with your conveyance of ideas, and the general tone has been very, very, very scholarly and very much engaging. So I look forward to another great week of class. If you have any questions, please let me know, and I will see you in the discussion forums. Oh, one last thing, grading for the discussion questions this week. I anticipate that I should be having done at the latest by Wednesday. I'm going to be working on the grading on Tuesday and Wednesday, with most of my feedback and the discussions coming through the weekend. I'll see you in class.